Hello, this is Dr. Grande. Today's question is, what is social anxiety disorder? So social anxiety disorder is a disorder that involves fear, anxiety, and sometimes panic when social situations occur. So if we look at the definition of social anxiety disorder from the Diagnostic and Statistical Manual, the DSM, we see the first criterion is anxiety or fear in social situations where there is a possibility of exposure to scrutiny. So this is really a key characteristic of social anxiety disorder. The emphasis is really on these social situations where somebody is afraid of negative evaluation. The second criterion is that there's fear of acting in a way that will result in negative evaluation. So somebody's afraid they might humiliate themselves or embarrass themselves. And this takes on a lot of different forms in terms of what specifically a person is worried will happen and what types of social situations can trigger that. This isn't only related to public speaking, but it can be all different types of public performance. The next criterion is that social situations almost always result in anxiety or fear. So if there's an individual who occasionally has an intense anxiety reaction to different social situations, they may not qualify for a diagnosis. So the next criterion, social situations are avoided or they're endured with intense anxiety or fear. Next criterion is that the anxiety and fear are out of proportion to the actual threat. So it's not unusual that individuals are worried or have anxiety and fear about situations that are actually threatening. With social anxiety disorder, we believe that most of the time that reaction is out of proportion to what's actually going on, meaning there may be some threat there, but it doesn't rise to the level that matches the anxiety, fear, or panic that we observe. The next criterion is that the disorder, the disturbance, lasts longer than 6 months. We typically think of social anxiety disorder as persistent. Also, it must lead to clinically significant distress in social, occupational, or other areas, and it can't be better explained by substance use disorder, another mental health disorder, or a medical disorder. So there are instances where individuals have social anxiety disorder, but it only relates to performing. So some sort of work performance, public speaking, something like that. This would be a performance-only specifier. This is not a subtype, but rather a specifier. It gives us more information about the presentation of social anxiety disorder. A lot of times, of course, with social anxiety disorder, it's not linked to just performance. There could be situations that a person's in where all they need to do is sit, for example, in a crowded room. They don't really have to do anything in terms of performance, and they still have panic, anxiety, or fear. So this would be an instance where it's not performance only. In the DSM, of course, with the specifier, it's either performance only or nothing. There's no other specifier. So it's either that specifier is there or there's no specifier. The 12-month prevalence in the United States for social anxiety disorder is 7%, and the median age of onset, that's the age that occurs most of all the ages of onset, is 13. This disorder is thought to be more genetic than environmental. Both components play a part in the etiology, but the genetic component appears to be stronger. A first-degree relative will have 2 to 6 times the risk of developing social anxiety disorder. And a trait that's associated with social anxiety disorder, behavioral inhibition, is known to have a strong genetic component. Disorders that are comorbid, that tend to occur at the same time as social anxiety disorder, include other anxiety disorders like generalized anxiety disorder, obsessive-compulsive disorder, panic disorder, agoraphobia. Also, major depressive disorder is comorbid, and substance use disorders are comorbid with social anxiety disorder. So social anxiety disorder is often confused with other anxiety disorders. Most often I found it's confused with panic disorder, agoraphobia, and sometimes generalized anxiety disorder. What makes this even more difficult in terms of a diagnosis is, as I mentioned, those disorders are often comorbid with social anxiety disorder. But we can work to differentiate them. For example, with social anxiety disorder, a lot of times we think of the panic attacks, the intense anxiety or the fear, as being expected, meaning an individual with this disorder will know when they're at risk for a panic attack or the intense fear or anxiety. With panic disorder, they're thought of as more unexpected. The panic attacks are oftentimes unexpected, and the cause of the panic is not fear of negative evaluation as it is with social anxiety disorder, but rather being concerned about having another panic attack. Now again, it's not unusual that individuals have both of these disorders, social anxiety disorder and panic disorder. With agoraphobia, this one's also difficult in terms of a differential diagnosis because there is a fear that occurs in certain places. With agoraphobia, they're spelled out in the diagnostic criteria. With social anxiety disorder, again, it's the fear of negative evaluation of other people. One way to look at differentiating agoraphobia from social anxiety disorder would be an individual with agoraphobia without social anxiety disorder would be afraid, would be fearful in those situations that are specified in that definition, even if they were alone. So an individual with social anxiety disorder, there really needs to be other people there in order to lead to panic or fear. It's that fear of negative evaluation that can only happen if other people are present. In terms of differentiating the disorder from generalized anxiety disorder, generalized anxiety disorder is more of a worry and a nervousness that occur a lot of the time, or most of the time. Social anxiety disorder is more specific to instances of public performance, public speaking, or social situations. Now, there can be anticipatory anxiety, of course, with social anxiety disorder, and anxiety after a particular public speaking or performance event. But we don't think of the anxiety associated with social anxiety disorder as occurring when there's no stressor. Now, social anxiety disorder also has some other characteristics that I've discovered through years of treating people with this disorder. There have been themes that have emerged. One of the elements that I think surprises a lot of people is that it has a cyclic nature to it, just like a lot of other mental health disorders. An individual, say, can be comfortable with speaking in front of a group of maybe 8 or 10 people, but they're distressed if it's more than that. Yet a few years later, they may be distressed when talking in front of 8 people. So the disorder seems to cycle in and out. And the same thing can happen in the other direction. Somebody can be uncomfortable standing in a line at a grocery store, for example, because of the fear of negative evaluation, not because of agoraphobia. And they can, a year later, 2 years later, be okay with that. They become comfortable with that. And the symptoms can return. So it's not always a steady pressure. It does have a cyclic component. The symptoms come and go. And I think this is particularly frustrating for individuals who are in therapy for social anxiety disorder because they believe they're making progress, and then the anxiety symptoms can come back inexplicably, seemingly out of nowhere, and it feels like they go a few steps backwards. It's important to remember, of course, that we think of this disorder as persistent. It can go into full remission, of course, but we think of it as hanging around for a long time. So even if a person has made a lot of improvement in terms of the anxiety or the panic associated with social situations, there oftentimes going to be still a component that's there, a component that can be activated by a particularly stressful event. Another feature I've noticed with social anxiety disorder is that there's this perception sometimes that individuals who have this disorder don't realize that the situations aren't really threatening. That's actually not true. Many individuals, I would say most individuals with social anxiety disorder, realize that there's not much of a threat in reality. They realize that the fear is irrational, but the fear occurs anyway, and of course this is what's linked to the panic or the anxiety. So it's not a matter of understanding the actual threat level. People with social anxiety disorder generally do understand that the fear is irrational. Another element that I've noticed with social anxiety disorder is a lot of times we think of these social situations as just a number of people or a particular circumstance that can trigger the anxiety or the panic. But oftentimes it's dependent on who those people are. For example, an individual may be comfortable talking in front of coworkers, but they may not be comfortable talking in front of authority figures. And there can be a fairly drastic difference between the number of people in terms of triggering the anxiety response. For example, an individual could be comfortable talking in front of 20 coworkers, but not be comfortable talking in front of just 3 authority figures or just 1 authority figure. So it's very important for many people who the people are. The performance anxiety, the public speaking, is linked to who the people are, not just how many. It's not just about quantity. Another element about social anxiety disorder I think gets missed. A lot of times there's a focus on the actual public speaking or the performance. And of course this is extremely painful for people. The intense anxiety, the panic, there can be physiological symptoms and often are associated with, of course, a panic attack and even with anxiety. But there's also anticipatory anxiety and anxiety that occurs afterward. So say there's a particular performance stressor that has to occur. Somebody has to perform in front of other people. Oftentimes there's going to be anticipatory anxiety days or weeks in advance of that. So a lot of suffering. At the moment of the performance, whatever it is, there could be anxiety and panic, and of course that causes a tremendous amount of suffering. And then afterward, particularly with social anxiety, there's a lot of rumination on what happened during that performance. Oftentimes a person will think that other people didn't like them. They'll go through every word they said and analyze it and worry about specific details of that performance. So there's pain before, during, and after with social anxiety disorder. Another element in terms of after a panic attack is it's not unusual for people to be exhausted. It takes a lot out of a person to have a panic attack. So during the performance there was panic, and afterwards there's oftentimes exhaustion. This can be particularly frustrating for people with this disorder because they fight to cope through this really stressful period, and then afterward they're exhausted and they don't feel well. So the suffering associated with social anxiety disorder is not just limited to the performance or the public speaking or whatever it is. Another element I've noticed with social anxiety disorder is sometimes people incorrectly evaluate individuals who have this disorder as being unfriendly. And I've found this to be far from the case. The vast majority of people with this disorder are friendly. They want to make friends. They're afraid of that negative evaluation, so that's interfering. But in terms of their personality, in terms of their desires, they are friendly. Also, shyness is not as tied to social anxiety disorder as a lot of people think, not as associated. Only about 12% of individuals who are shy could be diagnosed with social anxiety disorder. So there are a number of misconceptions about social anxiety disorder. It's actually a bit of a complex disorder. It's not particularly easy to understand. There are a number of treatments that seem to be effective in many cases of social anxiety disorder, including multiple types of cognitive behavioral therapy, like rational emotive behavior therapy and cognitive therapy. I hope you found this description of social anxiety disorder to be interesting. Thanks for watching.